Sinusitis. Attention. The information in the article is a reference and cannot be used for self-diagnosis and self-treatment. If you experience any symptoms of the illness, consult your treating physician. Content. Types of sinusitis. Causes of sinusitis. Symptoms and signs of sinusitis. Diagnosis of sinusitis. Treatment of sinusitis. Maxillary sinusitis is an inflammatory lesion of the mucous membrane lining the inner surface of the maxillary sinus. The disease manifests as headache, discomfort in the paranasal area, and symptoms of general intoxication. The disease is acute or has a chronic course. It affects adults and is detected in older children. Sinusitis has an ICD code, J32.0. Sinusitis. Types of sinusitis. The division of sinusitis into forms is determined by the nature of the course, the causes of its occurrence, and the localization of the pathological process. Defeat can be bilateral or unilateral. Purulent. A variant of sinusitis in which a bacterial lesion of the maxillary sinus mucosa occurs. These spaces are filled with pus. The pathological process involves one or both sinuses. In purulent sinusitis, the patient experiences pain in the middle of the face. This type of pathology is because pus in the sinuses can trigger inflammation of the brain membranes, catarrhal. In this type of sinusitis, infiltration of the mucous membrane lining the sinuses occurs. It manifests as swelling and is accompanied by the release of moderate amounts of serous mucus fluid. In catarrhal sinusitis, the mucous membrane is hyperemic and congested. A thickening of the vascular plexuses in one or both sinuses is observed. Often, bilateral catarrhal sinusitis develops immediately. Odontogenic. It is characterized by the presence of inflammation of the sinus mucosa, caused by the penetration of the pathogen from the main focus of infection. It is located in the area of the upper jaw. The most likely source of infection in odontogenic sinusitis is a diseased tooth. This occurs in people who have peculiarities in jaw structure. Their tooth root tips are directly beneath the mucous membrane. Bilateral. This type is characterized by the simultaneous involvement of the paranasal sinuses on both sides. It occurs less frequently than unilateral damage. Bilateral sinusitis has a more severe course. Compared to unilateral inflammatory process, it is more likely to have a chronic course. Sharp. This form of the disease is more often detected in patients than in others. Acute sinusitis is characterized by its occurrence as a complication of an acute respiratory viral infection. Swelling quickly forms in the sinuses, and exudate accumulates. Clinical manifestations of the disease occur rapidly. It does not last more than 3 months. Then the symptoms of the disease disappear. Chronic. This form is a complication of acute sinusitis. It occurs when the disease is treated untimely, incorrectly, or terminated prematurely. Chronicity of the process is facilitated by curvature of the nasal septum, hypertrophied adenoids, proliferation of polyps, presence of a tumor in the nasal cavity. Causes of sinusitis. It transitions into an acute form due to the development of complications from viral infections with nasopharyngeal involvement. This occurs due to swelling of the mucous membrane, which begins to constrict the opening for connecting the sinus with the nasopharynx. Exudate accumulates in its cavity. Excellent conditions are created for the reproduction of bacteria. Main reasons: allergic rhinitis, chronic runny nose, vasomotor rhinitis. Against the background of decreased immunity, acute fungal inflammation can develop in the patient. Acute sinusitis can be quickly dealt with adequate therapy. Reasons for transitioning to chronic form: presence of bronchial asthma or allergic rhinitis, frequent respiratory infections, permanent residence in conditions with polluted air, polyps and tumors in the nasal cavity, deviation of the nasal septum, abuse of blood vessel constricting drops, smoking, dehydration of the body, taking medications that reduce immunity. Symptoms and signs of sinusitis. Sinusitis has distinct characteristic symptoms. The main manifestation of the disease is considered to be pain sensations, which are localized in the middle third of the face and paranasal region. Pain in sinusitis has its own peculiarities. Their intensity increases in the evening, and in the morning they are practically absent. How does sinusitis manifest? Symptoms of acute sinusitis. Headache in maxillary sinusitis has a swelling, intense character. Signs of general intoxication are noted. General weakness, nausea, a feeling of weakness, body temperature rises. Tearing and photophobia are noted. Nasal breathing is difficult. In maxillary sinusitis, the sense of smell is impaired. Nasal discharge can be clear or purulent. If the process has spread to the periosteum, the swelling of the orbit and cheeks on the affected side is noted. In children, the symptoms of sinusitis are pronounced. Signs of general intoxication prevail over local signs of inflammation. Weakened people. The only manifestations of the disease can be increased weakness and quick fatigue, but this is attributed to other health problems. Symptomatic sinusitis is dangerous with its complications. The infection spreads to other organs. Therefore, if a disease is suspected, it is necessary to immediately consult a doctor. Gameritis without temperature. The presence of a temperature reaction serves as a manifestation of the body's fight against infection. If the immunity is low, then this doesn't happen. The temperature remains normal. Sinusitis flows without it in chronic forms. Nasal sinusitis without nasal congestion. If the caries has dissolved the oral cavity and penetrated the oral cavity, the infection proceeds without a runny nose. This is facilitated by injuries to the facial bones and the curved septum of the nose. Diagnosis of sinusitis. Before treating sinusitis, it is necessary to thoroughly examine the patient. The patient is examined as follows. The doctor first examines the patient's medical history and complaints. He examines the nasal cavity and the projection of the paranasal sinuses, performs facial soft tissue palpation. During rhinoscopy with a special device, the doctor examines the nasal mucosa, finds its swelling and hyperemia. The ENT doctor examines the respiratory and olfactory functions of the nose, using special tests. With the help of diaphanoscopy, the sinus is illuminated. In unilateral sinusitis, the darkening of the half of the face is fixed. During radiological examination, a clear image of the paranasal sinuses is obtained. The sinusitis in the image is visible as a darkening of the sinus. Ultrasound examination allows us to determine the presence of liquid. CT and MRI are performed if there is a suspicion of tumors, polyps, and cysts in the sinuses that complicate the course of the disease. Diagnostic puncture is performed to clarify the exudate and subsequently identify the disease pathogen during sewing. Endoscopic diagnostic methods are used to study the condition of the maxillary sinus mucosa during examination. Laboratory diagnostic methods: blood for HIV, immunoglobulins, immunogram. If necessary, additional diagnostic methods are used to clarify the diagnosis. Treatment of sinusitis. How to treat sinusitis. Now, there are several effective methods that allow you to get rid of it. In inflammation of the mucous membrane, the maxillary sinus is filled with exudate, which can be very viscous. He doesn't leave on his own. He has to be evacuated. One of the treatment methods is to pierce this cavity. Maxillary sinus puncture. A puncture of the maxillary sinus is a puncture of its wall, using a sharp instrument. This is necessary for the evacuation of the inflammatory contents. It is often used for drainage in sinusitis. In the case of the accumulation of viscous contents inside the sinus, which do not leave on their own, it cannot be extracted by other methods. Puncture in maxillary. Sinusitis quickly alleviates the patient's condition immediately after the evacuation of the inflammatory exudate. The sinus is also punctured when the patient's condition is threatened by the rupture of purulent exudate into the surrounding tissues with irreversible consequences: meningitis, otitis, encephalitis, sepsis. Stages of the procedure. The puncture is performed in the lower nasal passage area using a special needle with a curved and inclined tip. Under visual control, it is introduced into the lower nasal passage. Here, the bone is minimal in thickness, making it easier to pierce. The needle rests on its arch. Its penetration depth is up to 2.5 cm. Its needle is advanced to the outer edge of the eye socket. Using a syringe, the doctor evacuates the contents of the sinus and washes it with antiseptic solutions. After the procedure, the patient is laid on their side for half an hour. The solution is monitored to exit the sinus cavity. Methods of treating sinusitis without puncture. It is preferable to treat without using sinus puncture, as this treatment method often leads to complications such as bleeding, vascular thrombosis, and others. There are other methods that are effective for this disease. Application of antibiotics for sinusitis. Antibiotics for bacterial sinusitis are a means of choice. Several groups of these agents are used for treatment. Penicillins, fluoroquinolones, macrolides, and cephalosporins are most commonly used. The medication for treatment is chosen by the doctor. Therapeutic procedures. Less invasive methods are used for treatment. They are used for sinusitis to wash the sinuses. The following methods are used. Cuckoo. The patient is placed on a couch. Then, using a tube, the antiseptic is introduced into one nasal passage, and a tube is placed in the other for draining exudate from the sinuses. Balloon sinusoplasty. Gas is pumped into the sinuses. It expands the lumen of the sinuses. After this, the contents of the sinus are removed. With the help of procedures, effective treatment of sinusitis is carried out. The methods allow for the removal of inflammatory exudate from the sinuses without puncture. They are so safe that they are used to treat sinusitis during pregnancy. Physiotherapy. It is used in complex therapy for sinusitis. The methods activate biochemical processes and restore metabolism. In treatment, the following are used: electrophoresis, radio wave therapy, ultrasound exposure, OIF. Physiotherapeutic methods in combination with other types of therapy significantly accelerate the recovery process. Drug therapy. In addition to antibacterial agents, other medications are used. For this purpose, the following means are used: antihistamines help to relieve tissue swelling, blood vessel constricting sprays and drops. They facilitate nasal breathing. Glucocorticoids reduce allergy symptoms, have anti-edema and anti-inflammatory effects. Success in treating the disease depends on the rational combination of all therapy methods. If conservative treatment is ineffective for sinusitis, surgeries are performed. In maxillary prosthetics, the sinus is opened and the pathological contents are removed. What can be done at home? Treating sinusitis at home is dangerous. You shouldn't engage in self-treatment. Home treatment is used to alleviate the condition before going to the doctor. Let's discuss what can be done at home for sinusitis. Nasal drops for sinusitis. This maxillary sinusitis remedy has a local effect. They are necessarily supplemented with general-purpose drugs. The following drops are used: vasoconstrictors, relieve tissue swelling, normalize nasal breathing, antiseptics, inactivate pathogenic microorganisms that cause inflammation. Antibacterial drops have a bactericidal effect. Mucolytics liquefy pus in the sinuses and facilitate the removal of mucus. These remedies are a good addition to the main treatment. Nasal flushing. What should you wash your nose with in maxillary sinusitis? Nasal cleansing solutions contribute to the excretion of contents from the sinuses. By washing the nose in maxillary sinusitis, the mucous membrane is moistened. For this, they use ready-made solutions sold in pharmacies. Humor, Dolphin, Aquamaris. You can rinse your nose with salt solution or furacillin solution. Inhalations. Inhalations are recommended for the treatment of chronic sinusitis. The simplest way is to apply steam procedures. Inhalations for sinusitis are better performed using a nebulizer. It sprays medicinal solutions as finely dispersed particles. They penetrate the sinuses well. Anesthesive and antipyretic. At high temperatures above 38 degrees C, fever-reducing agents can be taken. They will help her down. In case of a headache, pain medications can temporarily relieve it. Self-massage. Before the session, the hands are thoroughly washed and wiped. The movements should be light. The wings of the nose are carefully massaged with the fingertips. The tip of the nose is pinched. The area of the nasolabial folds is loosened. Then gently rub the cheek area. Then proceed to stroking the bridge of the nose. Massage the area of the outer corners of the eyes. The procedure is performed for no more than 5 minutes. Massage can be done up to 5 times a day. Before applying massage, it is necessary to consult with the treating physician. People's funds. Treatment of sinusitis with folk remedies is carried out only as an additional measure. It should not replace traditional therapy.